Good morning, everyone. This is Chelsea Whittington, bringing you live coverage on behalf of CWIT PR. Our very own Dr. Roland Walker, our health commissioner, and Gary Native is getting ready to take the COVID-19 vaccine, and he asked that I be here today to capture this moment to help educate the masses on the vaccine and monitor his condition thereafter. So let's just take a look at what's going on.
I've never had this many people watch me.
Right. Dr. Walker, how are you feeling?
Anxious anticipation.
Okay. And tell us why you decided to do this.
Main reason is making sure in the African American community that we were able to have confidence in this vaccine. There's been for good reasons, by the way. There's a lot of skepticism about this vaccination, but this is a blessing to our community to bring, to try and alleviate some of this disease, and we need to have confidence in what we're doing.
Okay, and there has been a lot of hesitancy in our community. Why do you think that is?
Well, just like, there's a lot of history of not listening to the African American population in terms of treatment, in terms of bad things happening during experimentation. So, it's very reasonable that those anxieties are there. But we need to get past it, so here we are. And I want to show that I have a lot of confidence in this very clean vaccination.
Clean?
Yes.
Okay.
It's a very simple, clean vaccination. Not a lot of preservatives in it. Very targeted. So this is what we need.
Now, I understand there's supposed to be 2 doses, so is this the first? And
this is my first dose, and 21 days later, there will be a second dose.
Okay.
And for full protection, you need to have both doses.
Both doses. And you come in order of the first round for the simple fact that you're a healthcare worker. What's
Correct.
the order that is going to happen for distribution?
So this is phase 1. So healthcare workers, particularly people that work inpatient, are getting this vaccination. Phase 2, we're going to be looking more at essential workers, people who are public, government officials, and so forth. And then phase 3, it'll be more of general distribution. So we're looking at a long-term plan.
All right. And I know that your wife is a doctor as well.
Yes.
Will she plan to get the
Yes,
vaccination?
she plans to get the vaccination as well.
All right. Here we go.
That's it?
That's it.
Oh, wow. That's good.
Oh, you get a lollipop.
Let's get a lollipop for that.
Yeah, you get a lollipop now.
Yay.
So,
I expected a lot more pain than that.
yeah.
Does
Well,
it really?
You guys are now getting here. Day late, a dollar here.
so
Should be
Dr.
just
Walker,
next
I want to give you this last opportunity to just tell, well, not last because we'll be talking to you over time, but for somebody that's watching like, no, I'm not going to do this, what would you say to encourage them to at least get the information?
Lots of good information through the CDC, so please look on the CDC websites, look at the State of Indiana Health Department website, and by all means contact your local health department, the Gary Health Department, and we were glad to have conversation with you about how this vaccine fits in all of our lives and how this will make our lives better.
We know you made the headlines for contracting COVID along with your parents and caring for your parents. As a friend of yours and just knowing your family, can you share with us how you're doing and how your family's doing?
So my parents are improving greatly every day. We're caring for them, and mostly I'm doing this for them too, because as we care for them, I don't want to take virus back to them again. We don't want to experience what we experienced before. But I appreciate that because they are doing well.
Thank you.
Okay, so this goes with you, showing that you received the vaccine. You get a little sticker saying you gotta hear at Methodist Hospital you did it.
Yay.
You did it.
Show us your sticker, Doc.
Let's see.
Thank you.
And it didn't hurt?
No.
Okay.
No, I didn't.
That's what I want
I
to know.
barely put the needle go in.
Better than a flu shot, right?
No, that's much better than
No,
the flu shot. And I
I
just
don't even
recently
do
got
the
my flu
vaccine.
shot. This is much better than the flu shot. Absolutely.
Would you recommend getting the flu shot as well?
Absolutely.
And why?
Because the last thing you want to do is have influenza on top of a COVID infection. So we want, and you don't want to confuse the two. So yes, please get your yearly flu shots. Please, I beg of you.
Thank you,
You have
doctor.
to wait 15
I have
minutes.
my 15 minutes of.
So now Dr. Walker has to wait 15 minutes. We are here at Methodist Hospital in Gary, Indiana, and our health commissioner, Dr. Roland Walker, has just taken the COVID-19 vaccination. This is only the beginning, and so I just ask that you follow along with CWIT PR as we will be working with community organizations to track the vaccination process taking place here in Gary, Indiana. Thank you so much for watching, and we ask that you please share this video and just stay informed. We know there's hesitation and a lot of clouds of mystery around the vaccination, but we definitely want to put the information out there for you and your families to make the most sound medical decision for you and your families. Everybody have a great day.